Which natural supplements can you try to help you sleep? Now, any good integrative holistic healthcare provider is going to tell you don't just take a supplement for a symptom without changing your lifestyle. Western medicine often pushes quick fixes with pills for problems. Natural supplements can help you sleep, but not if you haven't adjusted your lifestyle first, including many of the recommendations I have in my other sleep-related videos. This includes diet, exercise, stress reduction, addressing any medical or mental health issues, good sleep hygiene, a comfortable mattress, and a healthy bedroom environment. If you're working on all that, but you still feel like you need something to help you sleep or reduce your stress and anxiety level, and you want something natural, there are some good, proven options out there. Now, before you take a supplement, make sure it's from a reliable manufacturer and distributor. There are poor quality and counterfeit supplements out there. Supplements are not regulated with the same scrutiny as prescription medications. Also, always check with your doctor first to make sure any supplement you take is safe with any medicines that you're on or medical conditions you may have. The most common and popular sleep supplement is melatonin, which is a synthetic version of something that your brain produces at night to tell you that it's time to go to bed. Now, there's a wide dosing range of melatonin from 0.3 to as high as 20 milligrams. Most people use between 3 to 10 milligrams, but you may be more or less sensitive than other people. I prefer the liquid or dissolvable melatonin versus the pills. There are a few risks with melatonin, but I would always check with your doctor first. Magnesium is a mineral that can be very safe and has a calming effect. Most people take between 200 to 600 milligrams, but there are some medical conditions where magnesium can be dangerous and you can take too much. Different preparations of magnesium are absorbed differently than others. I prefer magnesium glycinate, oxalate, or threonate, but there are other good ones as well. Lithium orotate is another calming mineral. It's typically dosed between 5 and 20 milligrams. It's not the same lithium that we use as a prescription medicine for manic depression. Certain herbs can help sleep, including chamomile, valerian, kava kava, passion flower, and lemon balm. These are best taken in tea form or drops. CBD or cannabidiol, preferably without the THC, I have other videos on that controversial topic, can be effective, and the typical dosing is 25 to 100 milligrams on average. There are also herbs out there called adaptogens, and they help block the fight-flight response when we feel stressed. These include ashwagandha, rhodiola, and others. Some people use GABA or 5-HTP. Places that sell supplements often have preparations with calming names, and they have a mix of many vitamins and herbs. They call it a proprietary formula. I don't like these generally because you never really know how much of what you're getting. They tend to be more expensive, and none of these have typically gone through any kind of testing to see if they work and they're safe. Just because natural supplements are natural doesn't mean you won't have side effects from them. You may have to try several different ones or a combination of a few to find something that works best for you. If you're trying to get off of an addictive habit-forming anxiety or sleeping pill that you've been on a while, there may be withdrawal from those medicines. And you might think the supplement isn't working. It just may not be strong enough to compensate for any withdrawal you're having. Withdrawing from a habit-forming anxiety or sleeping pill can take many weeks or more, sometimes depending on how long you took it, how much you took, and the type of medication you were taking. Now, the supplements I mentioned here I'm more familiar with, but there are other ones out there that have plenty of clinical and research data to support their use as well. So always make sure you do your research. Use your healthcare provider as a resource before just taking something that's in a cool looking bottle and has a restful sounding name.